system. Let me share my screen. Hope my screen is visible to everyone. Can anyone please confirm? Are you able to see my screen?
President, please respond.
Yes. Okay, thank you. So, before moving on to the lymphedema, so just see some that anatomy, because we need a learn anatomy. We know from the nursing school itself, we learned anatomy and physiology. So this is one of the major part palliative care, because lymphedema, we have faced a lot of patients. We have seen many patients with lymphedema. So we need to learn what is lymphedema. Throughout the lymphatic system, the lymphatic fluid is flowing. So that's called lymph. So lymph is a tissue fluid, right? Interstitial fluid is collected through lymph capillaries, then enters the lymphatic vessels to lymph nodes. It contains protein, lipids, and water. So it is an interstitial fluid. So that mild movement is enough. The mild pressure is enough to move the fluid from one place to another, because this fluid is situated in the interstitial space. Okay, it contains protein, lipids, and water. So we have to understand that what is a lymph. So throughout the lymphatic system, the lymphatic fluids are flowing. So let's see the functions of lymphatic system. So there are three major functions of lymphatic system. The first one is reabsorb excess interstitial fluid. So wherever or whenever the arterial and venous capillaries are communicating together, there is a chance of leaking out of fluid that from into the interstitial space. So that fluid class called lymph. So the lymphatic fluid which uh, drop into the interstitial space, the lymphatic capillaries are absorb the fluid from the interstitial space, and then it goes to lymphatic vessels and lymph node, and finally it goes to the subclavian vein. So that's why we usually call lymphatic system is also related to the circulatory system. It's a connection between the lymphatic system and the circulatory system. Okay, it's a part of circulatory. Actually, it is a part of circulatory system. So the reabsorption and excess interstitial fluid is there. So that is one of the major functions. That is why our fluid and electrolyte balance are maintaining well. And the next, the major function of lymphatic system is transport dietary lipids. So the especially in the small intestine, there are small villi are present. They are helping to transport the lymphatic fluid as well as the absorption of lipids also. So that kind of fluid called chyle, because of the lipids contains the fluid, the lymphatic fluids which you have seen in the small intestine is a milky color. That's why we call it as a chyle. So that is transport. So this is the another functions, transport dietary lipids. And the third function is that is very important. This is one of the most important function, lymphocyte development and the immune response. So if there is any problem, so develop in a particular area, that area will be prone to develop infection because there is no lymphocytes there, there is no lymph node. The infections any virus or bacteria can easily enter into the body because no lymphocytes are there to fight against bacteria. So this is our systemic circulation. So you all know that what is systemic circulation. From the that upper part of the body, you can see that thing. From the upper part of the body, superior vena cava will be helping the deoxygenated blood, collecting the deoxygenated blood, and it finally goes to the right atrium. From the lower part of the body, inferior vena cava will take the deoxygenated blood to right atrium. So you can see the lower part of the body and the upper part of the body. There is a connection between the arterial capillaries and the venous capillaries. You can see that from the right atrium, with the help of right and with the help of pulmonary artery, it goes to right and left lungs. For what? For purification of blood. For purification of deoxygenated blood. So into the lungs also there is a connection between the arterial capillaries and the venous capillaries. So this is our systemic circulation. So from this picture, you have to understand that there is a connection between the arterial capillaries and the venous capillaries. Okay. So coming to the interstitial space. So as I mentioned earlier, there is a connection between the arterial capillaries and the venous capillaries. So whenever the arterial capillaries and the venous capillaries are communicating together, there is a chance. So because of the muscle movement, the communications happen. So there is a chance of leaking of fluid-like substance into the interstitial space. So that fluid is called lymph. So from the interstitial space, the fluid which they drop into the interstitial space during the arterial and venous capillary filtration time. So the lymphatic capillaries which help to absorb the fluid from the interstitial space. You can see that green color picture. So there are, and the lymphatic capillaries are overlapping into the endothelial cells, and so wherever the fluid is dropping, so that lymphatic capillaries are absorb the fluid from the interstitial space, and it goes to lymphatic vessels and lymph nodes, and finally it goes to the subclavian vein. So there is a from into the tissues, especially in the interstitial space, wherever it can happen. So coming to the lymphatic capillaries, what is lymphatic capillaries? So it has blind end. So it has blind end so that wherever the fluid is drained, this will help to absorb the absorbic well because it has blind end. And single layer of overlapping endothelial cells, say clustered form, and it is the overlapping like endothelial cells because more permeable than that of blood capillaries. So this is can easily this lymphatic capillaries can easily absorb the large molecule also. So this is the structure of lymphatic capillaries. Coming to the lymphatic capillaries into the small intestine, especially lacteals, the small intestine contains special type of lymphatic capillaries called lacteals. So lacteals pick up of interstitial fluid and also the dietary lipids and lipid soluble vitamins. So that area, the lymphatic fluid is quite milky color. So we usually call that kind of fluid like chyme. Coming to the lymph nodes. So after lymphatic capillaries, you should understand what is lymph nodes. So it is small, round or oval shape things. So it is located in the pathway of the lymph vessels. It's around 600 to 700 lymph nodes in our body. Okay, 600 to 700 lymph nodes in our body. From this picture also you can see there are lot of lymph nodes in that body also. Okay, in between the lymphatic vessels, it was located. Okay, so length is 6 to 25 millimeter, typically found in clusters. Receive the main function of lymph node, because why the lymph node is there is the lymph node is receive the lymph from the many body regions. So the lymph nodes are also found in individually throughout the body tissue. Okay, so the lymph node will receive the fluid from the lymphatic lymph vessels, and then there is a filtration happen. Okay, how the lymphatic system works. So the lymphatic system circulate protein-rich fluid throughout the body. So it might contains bacteria, virus, and waste products, because it has blind end. The lymphatic capillaries has a blind end. It's more permeable than that of blood capillary. Whenever the interstitial fluid there, so there the lymphatic capillaries are absorb the fluid from the interstitial space. It might be contain bacteria, virus, and waste products. Clear? Then from the lymphatic capillaries, it goes to lymphatic vessels, lymph vessels, because when the lymphatic capillaries are absorb the fluid from the interstitial space, it goes to lymph vessels, and then it goes to lymph nodes for filtering out the harmful substance from the lymphatic fluid. Clear? The major function of lymph node is to filter out the harmful substance from the lymphatic fluid. After that, the waste are flushed from the body and the clean lymphatic fluid drains into the bloodstream. So the lymphocytes are having a major role into the lymphatic system. So they will be there to fight against bacteria. They will try to kill the bacteria, but sometimes it fails. Then that fluid, it goes to the another lymph nodes. Again, one filtration can happen. So there are multiple filtrations can happen, but because that might be chance of bacteria, virus, and waste product into the lymphatic system. So this is the anatomy of lymphatic system. So coming to the pathophysiology, how the lymphatic system works. Wherever the lymphatic fluids are absorbed from the interstitial space, then it goes to lymphatic vessels, and then it goes to lymph node for filtering out the harmful substance. Again, it goes to lymphatic vessels, and then again it ended in the another lymph node, and then through the lymphatic trunk collecting that, it goes to the subclavian vein. So this is how the lymphatic systems work. Coming to the lymphedema. So now you all understand the function, anatomy, and physiology of lymphatic system. Now we are going to learn about what lymphedema. What is lymphedema? Lymphedema is the pathological accumulation of protein-rich lymph fluid into the interstitial space due to an imbalance between in the interstitial fluid production and transport. Because if there is an imbalance between the production and transport, there is a chance of accumulation of fluid into the interstitial space. Clear? So always the production will be there wherever the arterial capillaries and the venous capillaries are communicating together. Definitely the lymphatic fluids will origin. So if there is a originate, because the production there, but the transportation will be difficult, because if you remove the lymph node from a particular area, for example, if the patient is diagnosed with, if one patient is diagnosed with carcinoma breast, they need to undergo a surgery. So they need to undergo a surgery. Removal of breast. What is total mastectomy? Removal of breast and the removal of adjacent lymph nodes. Why we removing adjacent lymph nodes? We need to prevent further recurrence. So that is why we remove the adjacent lymph nodes. If we remove adjacent lymph nodes, what happens? The lymphatic fluid productions are there. There is no lymph node for transport the fluid from the that affected area to the non-affected area. So there is a there is gap. There is a gap between the production and the transport. So that time there is a chance of fluid that there is a chance of accumulation of fluid that leads to edema. So this is how this is what we said lymphedema. So we have to understand that what is lymphedema. So if there is a production, interstitial fluid production is there, but transportation is difficult, that time there is a pathological accumulation of fluid, protein-rich fluid into the interstitial space called lymphedema. Coming to the classification, according to the International Society of Lymphology, it has classified into two, primary and secondary. So primary means congenital lymphatic dysplasia. From the birth itself, there is a malformation, that is primary. Secondary again classified into two, anatomical obliteration of lymphatic system. Now our lymphatic system is normal, but after that, if you develop any the surgery, maybe any disease or any recurrent infection or any trauma or a major road traffic accidents, that leads to the patients can develop edema. So secondary lymphedema again divided into two, non-malignant and malignant. So from this slide, you have to understand that non-malignant patients can also develop lymphedema because a recurrent infection, major road traffic accidents, burns, surgery related, radiotherapy, so treatment related. So these all will be affecting the lymph. There is a chance of affecting the lymph nodes. So after that, the patients might have developed lymphedema. Coming to the malignant, primary lymphomas and secondary recurrence. So these are the things you have to keep it in mind all the times. So how can we diagnose lymphedema? So we know not all edema is not the lymphedema. Other the disease conditions can also develop edema, because if the patient is having chronic renal failure, that patients can develop lower limb edema. Cardiac failure patients can develop edema. Respiratory failure patients can develop edema. So we have to take a proper history. If someone reports to you, I am having edema, then you have to take a proper history, whether there is any unknown cause, is there any disease related or trauma related, is there any major road traffic accidents happen or not, or treatment related. So after that, you can do the clinical examination. If you take a proper history, from the history itself, you can understand that what is the cause of edema. After that, you can do the clinical examination. So there are three major causes. Stage 0 is no edema, but the patient is have there is a chance of develop edema, but there is no edema at that time. So that time we set stage 0. So stage 1 is pitting edema stage. Pitting edema stage is look like a orange peel skin. Okay, this is the stage 1. If you apply your own finger pressure on that area, you can able to see your finger pressure on finger point on that area. That is stage 1. If you have seen stage 1 lymphedema, the patient with stage 1 lymphedema, you can able to manage easily. Coming to the stage 2, again, if you are not give a proper attention onto the stage 1 lymphedema, so that then it goes to stage 2. The tissues have become fibrotic, little bit hard, and no longer soft. So this is the second stage lymphedema. Third stage is the tissues are considerably hard and cartilage formation will be there. So the cartilage formation will be there. If the cartilage formation there, you can feel that tissues are considerably hard. And then stemmer sign. So this is one sign which we have seen in lymphedema patients called stemmer sign. So in a healthy person, you can also check in your the lower limbs or upper limbs. In a healthy persons, we can able to lift up your base of the second or middle finger. You can able to for a healthy person. For a lymphedema patient, you cannot. That is the positive sign of stemmer sign. Okay, so usually we can able to lift up the base of the second toe skin or middle finger, but if you are not able to pick up the fold of skin over the proximal phalanx or the middle finger, that means the patient is having lymphedema, the stemmer sign is positive. So these are the other diagnostic methodologies. So soft tissue imagining, MRI, CT, lymph vessel imaging, bioimpedance spectroscopy, these all things you can do. But if the patient, if there is a primary lymphedema there, you can do these all things because you need to determine the extra volume. You need to find out the cause. You have to detect any abnormalities. You need to measure the interstitial fluid volume. So these all things applicable in the primary stage of lymphedema, primary lymphedema. For the secondary lymphedema, these all things not needed, because if you do these all things, you can again spend more money. But from the patient history also, you will understand that there is a that diagnosis is lymphedema. From that, I think you can start the management. So no need to do these all things of these kind of test and spend more money or this the investigations. Coming to the problems. So there are physical problems, there are psychological problems, there are social problems, and there are spiritual problems. From the first day onwards, you understand that these kind of patients need total care, physical care, social care, emotional care, and spiritual care. So what are the physical problems? Pain and discomfort, because the fluid will be accumulated into the interstitial space. So our skin will stretch maximum. So at a point of time, the skin, because of the fluid overload, the patient may feel pain and discomfort. Tightness will be there. Heaviness will be there because they are not able to lift their limb independently because of the fluid volume. Fatigue, numbness, impaired mobility. They are not able to move their limb independently. They all always depend others. Loss of function. They are not able to do anything because the limb is more heavy than the other limb. So these all, if these kind of problems develop, it will be affecting the patient emotionally too. So coming to the body image, so I have seen many patients with lymphedema. Whenever they come to us, they usually cover the lymphedema part with their sari or that dhoti or whatever it is. If they have a that uh, long towel with them, they usually cover the lymphedema area with the towel or sari, that kind of things. So they are not willing to expose the affected limb to others. If the other person, if the public can see, sometimes if they see these kind of that edema, they will ask many questions. They need to answer it many questions. So they usually cover the limb with a that long towel with or sari clothes or any dressings. So that is one of the major problem because of the body image. They usually do like this. They don't want to expose this affected area to the other person. And loss of independence. Are not able to manage themselves independently because of the body that overweight edema because the fluid volume, the size of that limb is increased, and because of the edema, they are not able to they feel heaviness, they are not able to manage independently, and loss of change of employment. They are not able to, after that getting this kind of edema, they are not able to continue the same job because of this disease. These all will be affecting the patient emotionally and difficulty in wearing clothes and shoes. So if they want to wear a ready-made clothes, they won't be able to because the limbs are same, the hands and the shapes are same. So they don't, and also coming to the lower legs edema, if they want to wear a shoes, they will not be able to because of the edema and the anxiety, depression. So they will be anxious. What is next? See, if the edema is not controlled, they gradually goes to depression. So social isolation will be there. So before before this maybe before diagnose cancer, so they maybe they have many friends, relatives also usually come visit them after this disease. Nobody is willing to visit these house. Maybe misconception of disease, maybe they will be afraid about spreading of disease from that affected person to the non affected person. These kind of misconception will be there. So social isolation, society people are not willing to see these kind of patients, and from the patient side also, that because of the body image, they are not willing to go to the family functions, go and attend the family functions, or not exposed to the public. So that kind of social isolation will be there. And if the edema there, we know why the edema is coming. Because of the lack of lymph node in their body, uh, that the lymphedema can develop. So we all know that, but the patient doesn't know how the edema come. They will be thinking like my disease is spreading to my hand also. So this is the, if there is a edema there, there is a constant reminder of disease also because of my edema, because of my disease, the this hand is also affected. These kind of things will be there. Whenever you have seen a lymphedema patient, uh, uh, if possible, you can see the individual assessment. At the same time, you have to educate the patient about lymphedema, why the edema develop, how edema develop. This so these two things, how and why. So these are two important part you have to educate well, so that they will have a better understanding. Okay. And also spiritual problems. Why God punished me like this? So these kind of spiritual concerns will be there. Sometimes no care, but that a good caregiver is there. So they need to that apply bandages. They need to do the massage. These all things. They need a caregiver. If they don't have a good caregiver in their home, so they will be affecting the patient spiritually also, because nobody is there. No, why God punished me like this? These kind of spiritual questions will be there that time. Because of my disease, because of my sin, God punished me like this. These kind of spiritual questions will be there. If they that express these kind of spiritual questions, what you can do is listen. Just listen, and just sit down and listen why they are asking, why they are telling these kind of things. Maybe some problems behind that. You have to explore that problems, why they are telling like this, why God punished me like this. If there is no good caregiver there, they used to express these kind of emotions. So if there's these kind of emotions there, better sit down and talk to them, why you are feeling like this. So anything you want to that do from us. So anything you want to ask me. These kind of open questions you can ask, so that they can able to explore their emotions. So coming to the management. So coming to the management, there are four principles. One is skincare, the second one is massage. The third one is compression bandage. Fourth one is exercise. So these are the four principles of management of lymphedema. And one more things, intermittent pneumatic compression pump. So I'll come to that later. So skincare is important because there is no lymph node into that affected area. There is a chance of getting infection frequently. So we need to give a proper attention to that affected area. And the second important thing, I already said, the fluid are accumulated into the interstitial space. So our duty to the push the fluid from one area to the next that next part. So if you give a simple pressure to that area, the fluid can easily move one area to the next area. So you have to give a proper massage, and after that, after massaging, you can apply compression bandaging. You can use scrub bandages. If they are able to afford it, then you can think about stockings. And then exercise. So intermittent pneumatic compression is also the another option. So before doing the active management, you have to take a measurement, because we should know which lymph is huge and what is the difference between the affected lymph and the non-affected lymph. So when we take uh, the first time assessment, you have to take both lymph measurement. You have to take measurement for the affected limb and the non-affected limb. Clear? So for the upper limb, the head of ulna plus 2 centimeter, then every 4 centimeter. From the head of ulna plus 2 centimeter, you have to mark first there, and then from that part every 4 centimeter you have to mark first, and then you have to take a circumference. All this that measurement you have to document it well. And then for the lower limbs, from the angle joint plus 2 centimeter, then every 4 centimeter. I have a video on that. I will show it to you later. From that you will understand how to take a measurement. Okay. And then skincare. So this is very, very important. you have to give a proper education to the caregivers about lymphedema, the caregivers and patient about lymphedema. So that they will get an idea about what is lymphedema. And that second important part is education on about skincare. So that is must. If you don't give a proper instruction to them, so they might have developed recurrent infections. Apply simple moisturizing cream. So simple moisturizing cream just after bathing, not just before massage. If you apply moisturizing cream just before massage, what happen? You will not be able to move the fluid from one area to the another area because your finger movement will not be able to because of the that cream, because of the moisturizing cream, uh, your finger is slipping. So uh, just after bathing, they can apply. And meticulous drying between the digits. In between the digits, especially if the patient is having lymphedema, there is a chance of accumulation of dirt in between the digits, and that leads to the patients can develop fungal infection. So you have to give a special attention on that area. Avoid injections and veiny pinches. So if you do these injections and venipuncture, it will not have. Sometimes it will not affect the patient. But if there is any aseptic techniques there, there is a chance of developing infections. If there is the chance of the one bacteria or virus enters into that area, you have to keep it in mind. There is no lymphocytes are fighting up there to fighting about the bacteria. So there is no lymphocytes are fight against bacteria. So the patients can develop cellulitis. Avoid ulcers. Avoid blood pressure cuffs. These all will be affecting the collaterals. Avoid injury. If there is an injury happen, so you have to tell them keep that area clean and dry. If there is any signs and symptoms of infection, better they go to the physician and take a antibiotic treatment for that. So that is very important. And also you have to tell them to that carry that little weight, because if they take carry heavy weights, what happen? Again the blood circulation will increase. If the blood circulation is increased, what happen? The edema will increase, because whenever the arterial capillaries and the venous capillaries are communicating together, there is a chance of oozing out of fluid like substance into the interstitial space. So you here also, if you take heavy weights, what happen? Our blood circulation increase. If the blood circulation is increased, the patients can develop edema again. So that is also important. Coming to the massage, the second principle is massage. Massage, there are two ways of massage, two types of massage: manual lymphatic drainage and the simple lymphatic drainage. So, manual lymphatic drainage is done by a trained trained professionals, because we know where is the lymphatic fluid, how much pressure is need for moving the fluid from one area to the next area. If you train the patient for massaging to their affected area, they will give more pressure. If they give more pressure to that affected area, that leads to more edema, because the arterial and venous capillaries filtrations are more than the previous, because there is a massage. If you give a more massage, usually we tell in we discussed in that bed sore prevention. For bed sore prevention, we need to give a good massage, because there is we need a blood circulation, good blood circulation there. Whenever we turn the patient from one position to another next position, it's our primary duty to check the pressure points and uh, give some massage with the help of a moisturizing cream. So that we aim to improve the blood circulation. Here, if you improve the blood circulation, what happen? Edema will increase. So the simple pressure is enough. Here, manual lymphatic drainage is done by a trained professionals. It can be a doctor, it can be a nurse, it can be a physiotherapist. Okay, so the always you have to start with a deep breathing exercise. So, as I mentioned earlier, there are 600 to 700 lymph nodes in our body. So, if you take a deep breathing exercise, so if you done a deep breathing exercise, what happened? All internal lymph nodes are ready to, they are all stimulated and they are ready to receive the fluid from the that next area, because they are all stimulated with the, if you do the deep breathing exercise. So after that, after deep breathing exercise, you have to stimulate the superficial lymph nodes. Okay, so superficial lymph node means you can stimulate the neck nodes, you can stimulate the axillary nodes, you can stimulate the supraclavicular node, you can stimulate the submandibular node. These all will be there in this super. You can able to feel the see. You can able to give a massage directly, and groin also. We have a groin axillary area lymph nodes and groin also. So you can able to stimulate this all lymph nodes superficially. After that, you can stimulate the unaffected lymph node. So, for example, your if your patient is coming with you with the CA left breast, so that time definitely they will remove the left side adjacent lymph node also. So there is no lymph node there for that stimulation. There is no axillary lymph node left side. The axillary lymph node is absent. So what you can do is you have to stimulate the opposite side of the axillary lymph node, because that axillary lymph nodes are healthy and working conditions. You have to stimulate that, and then you have to massage the proximal part, then goes to the distal part. So our aim is to make a good pathway for moving the fluid from the congested area to the non-congested area. Clear? So that's why we encourage the patient to take a deep breathing exercise and then stimulate the superficial lymph nodes and then stimulate the opposite side of the lymph nodes and then massage the proximal area. Once the proximal area is clear, then goes to the distal part. Always use gentle pressure. Okay, so this is about manual lymphatic drainage. This is done by a trained professional. Coming to the simple lymphatic drainage. So this is done by a patient with the help of a caregiver, because they can take a deep breathing exercise. They should not touch the affected area. That is the only one restriction here. They should not touch the affected area. Why? If they touch the affected area, there is a chance of more pressure to that affected area. If they apply more pressure on that area, there is a chance of getting more fluid accumulation. So that is why we discourage the patient to massage the affected area. If it is done by a trained professionals, then you can do, you know how much pressure is needed. That is the major difference between the manual lymphatic drainage and the simple lymphatic drainage. So they can do deep breathing exercise. They can do stimulate. They can do the stimulate the superficial lymph node. They can stimulate the that opposite side of the affected axilla, and then they can apply bandages and then they can do the exercise. So these all things they can do it, but they should not touch the affected area. That is the only major difference between the manual lymphatic drainage and the simple lymphatic drainage. So these are some contraindications of manual lymphatic drainage. Acute cellulitis. If the patient is having cellulitis, So there is a chance of pain. So pain and renal and heaviness will be there. So we know what are the signs and symptoms of that infection. So if these kind of infection inflammation there, you should not do the active management. And renal failure, again renal failure is also, if the patient is having renal failure there, so there is a chance of fluid overload. You are going to push the fluid from the that edematous area to the non-edematous area. So so that time the fluid overload might be happen, that leads to the patients can develop breathing difficulty and all. So if the patient is having renal failure there, better you don't do the active management. Unstable hypertension, severe cardiac insufficiency, hepatic cirrhosis, like ascites, superior vena cava obstruction. So these kind of what is superior vena cava obstruction? So there is an obstruction into the superior vena cava. If you push the fluid from that upper part of the body, what happened? There is a chance of more fluid accumulation, and then that leads to the patients can develop breathlessness. So if these kind of problems, they are better you don't do the active management. But in cellulitis, you can do you can give a proper antibiotics management. After that cellulitis is controlled, you can do the active management. So now we can see the manual lymphatic drainage video, and after that I'll teach the next part. So thank you. I hope this video is clear to everyone. Any doubts? Anybody have any doubts? No. Thank you. So next we move on to the bandaging after the massaging. So the first principle is skincare. The next one is massage. After that, you can do the bandage. So bandaging, two that types, spiral bandaging and multi-layer bandaging, that is figure of eight. So during the initial stage, you can do the spiral bandaging, that is 50% overlap. So this patient is coming with edema, because if you do the multi-layer bandaging, that is figure of eight bandaging, initially they will not be able to tolerate the pressure. So we need to manage, because they need to do the bandaging, that wear the bandaging maybe 6 months or 7 months. Once the edema become reduced, then they can do the little skin care. If they are able to apply stockings, they can able to wear that. But during the initial stage, after in the initial period, they have to wear continuous bandages. So we need to train them. So initially you can train with spiral bandaging, that is 50% overlap. So after 1 week, you have to train the caregivers also, because when they go home, they have to do it their own. You have to train the caregivers how to do the bandages. So you have to you have to train the caregivers. In front of you, you have to ask them to apply bandages, spiral bandages. So that when they go back, they can able to help the patient. So after that, if the patient is able to tolerate the 50% overlap, that is spiral bandages, then you can think about the figure of eight bandages. So that is good because we need to that push the fluid from the affected area to the non-affected area. So the next you have to think about the figure of eight bandages. So always you have to cover the skin before applying a crepe bandages. So you have to apply a soft, thin cotton layer in the beginning stage. You have to protect the skin like that. After that, you can apply crepe bandages. For the finger, you can use the tubular bandages, but in India it will not be available. We used to use 6 centimeter bandages. We used to fold into two, make it 3 centimeter and apply into the onto the fingers. Okay, for the fingers. While we do the finger bandages, you have to give a special attention on the finger, the nail buds. You should not cover the finger nail buds. So if there is any obstruction, there is any obstruction there, you can able to see the nail buds cyanosis. If there is a cyanosis developed, that means there is the pressure is more. The tissues may not get adequate blood supply. And another important things, from the crepe bandages, that box itself, there is two metal clips. So that usually we used to fix the bandages, but here we don't use that clips, metal clips. We used to use the that paper micro pools. Okay, so if you use the metal clips, what happened? The metal clips will that break the skin, so that leads to sometimes the patients can develop cellulitis. So and then bandaging to the lower limbs, the same thing. You the initial stage you can wear spiral bandages or always protect the skin before applying crepe bandages. And if they are able to tolerate, then you can move on to the figure of eight. And if the edema is uniform, then you can think about stockings. So stockings also helpful, but the thing is during the night time. So this is more stretchable, more the elastic power is high. So if they are using stockings, better they should remove at night, because the when the edema comes down, the crepe band, the stockings also compress to the tissues, that leads to sometimes the tissues will not get the adequate blood supply. So better they will remove the stockings during the night time. But if they are we apply crepe bandages, no need to remove at night, because when the edema comes down, the automatically the crepe bandage will loosen. So that is the thing you have to keep it in mind. And then after bandaging, you can do the exercise. So here exercise and elevation is important. You can encourage the patient for minimal normal functioning, mobility and activity. If they are not able to move independently, you can yeah, so you can educate the patient, caregivers, for a passive exercise. And give exercise for fingers, because after the bandaging, there is a pressure on that area. If you give a exercise to the finger with the help of a physiotherapy ball, so that will help to move the fluid from that area to the next part. So after that, you can do one that exercise for their fingers, for their wrist, and after that one for their elbows, and then last one is for their shoulder. So after the bandaging, shoulder, that elbow, wrist, and fingers. So this is the steps. So these all things you have to keep it in mind all the time, because here no need to give more pressure. A little exercise is enough, not heavy exercise, little exercise is enough. Our aim is to move the fluid from one area to the next area. So this is intermittent pneumatic compression pump. So I discussed that earlier regarding this. So if the patient is having stage 1 lymphedema, that is pitting stage edema, pitting edema stage, then this will help, because this is a kind of that like a garment, plastic garment like this, like a BP apparatus cuff. Okay, so you can insert your affected area, affected limb to that garment, and we can able to adjust the pressure, and also you can adjust the duration also. So and that, but if you give a 30 to 60 pressure to that machine, for a duration 30 to 120 minutes. During this time, it will give 30 to 60 pressure all the time. So, like a BP cuff, what when we then inflate the bulb, the cuff, what happened? The pressure will increase. No, so this is in between. This will happen if there is a stage 1 lymphedema. This will help. Otherwise, it will not help. So after this, after IP intermittent pneumatic compression pump or bandaging exercise, you have to elevate the limb. So there are two complications. One is cellulitis, another one is lymphoria. We already discussed about cellulitis. If there is a cellulitis there, uh, you don't give an active management. You have to give a antibiotic management for this cellulitis patient. So once the cellulitis is controlled, then you can think about the active management of lymphedema. And then the second complication is lymphoria. Lymphoria means leaking out of fluid, excess fluid from the lymphedema area. So if you have seen these kind of things, what you can do is you have to cover the lymphoria area with a dressing pad, and after that you can apply crepe bandages. There is no restriction. You can apply crepe bandages here so that all excess fluid will come out. Thank you. So we have one more video. That video will show it to you now. That is about bandaging. Okay, thank you. Anybody have any doubts? Okay, so I hope it's clear to everyone. Thank you.
Thank you, ma'am. Thank you for the wonderful session. Thank you all for participating in the session. Thank you. Bye. Let's see in the next session. Bye.